and welcome to our cover story conversation. I have with me Dr. ROMMEL. He is the Director Internal Medicine at Max Healthcare, and one of our favorite guests, someone whom we haven't seen for a long time. I guess with a doctor, that is also good news, Dr. TICKOO, that everybody is hale and hearty. But this has been a season where we've seen the return of the flu, and it's a very funny strain. Everybody we know has been suffering of a flu, and they're saying that it's the normal medicines are not working. So what is happening exactly?
Priya, we've seen a lot of these flu-like illness cases in the last month or so. And we don't test everybody, but most of the cases have turned out to be H3N2 positive, which is a type of a strain of influenza A virus. H1N1 also
Okay.
belongs to influenza A virus, but the predominant strain this year is H3N2. Now, this particular strain does have a tendency to cause more severe disease and complications, though most of the cases are mild. So because
Hmm.
they keep mutating over the years, so symptoms are different each year. But this year we've seen a prolonged illness, more severe symptoms, and even after recovery, you tend to have fatigue, loss of appetite, and things
Yeah.
like that. And many patients are getting complications like bronchitis. Very few, the ones with comorbidities, risk factors, are landing up with pneumonia also. Very few need hospitalization. But this chronic cough, needing inhalers, nebulization, a lot of patients are getting that right now. And there's been a surge in the last 2 to 4 weeks. But the key is that you should know what it is because there's an antiviral medicine, oseltamivir. If used within the first 48 hours, it works the best. You can use it later also. But for that, you
Hmm.
need to know. But again, you don't have to test everybody. When there are too many cases in the community and turning out to be extreme, you just treat them. You don't have to test them. For the ones who have severe disease and the ones with comorbidities, the ones with mild symptoms, you don't have to do anything. Again, the bottom line here
And
is,
what are the
yeah,
symptoms, sir? Huh.
yeah. The symptoms are high fever, body ache, headache, sore throat, cough, cold, runny nose, loss of appetite, nausea, vomiting, diarrhea. Could be anything, a mixture of everything. And within the first 48 hours, you can take paracetamol, you can take rest, drink lots of water. But beyond that, do get in touch with your doctors because they will guide you. They'll tell you about the antiviral medicines, they'll tell you about complications, they'll tell you about the warning signs. See, most of the patients recover in 7 to 10 days though the recovery is prolonged this time. But if you land up with complications, what are you supposed to do? What are the warning signs? Like I said, chest pain, very high fever, persistent fever, cough, blood in sputum, respiratory distress, confusion, extreme weakness. These are bad signs. This means that you need hospitalization. So be in touch with your doctors. They'll decide whether you need a test, whether you need an antiviral medicine. Maybe you have very high fever with a little hint of cough. It can be dengue. So you
That
have
is
to be
also there.
careful.
Yeah.
Yeah, we are seeing dengue, though it's not too much this season. But yeah, there is an
Hmm.
overlap. Sometimes you think it's flu, it turns out to be dengue. So dengue, again, you have to be very careful. You have to drink lots of water and things like that. That's why you should be in touch with your doctors.
Yeah, because a lot of people are saying that the old formula of taking Dolo, paracetamol, whatever, it's not working. That's what really set
Yeah,
the fear in amongst
true.
everybody.
True. That's because of the strain. It's a mutated strain. It's causing more prolonged illness, more severe disease. So you need anti-inflammatory medicines also. Ibuprofen, diclofenac sometimes. Not paracetamol doesn't work. But again, it's
Hmm.
about time. 5 to 7 days, no matter what you do, you usually have symptoms. But yeah, symptomatic treatment helps. Antiviral medicines help. Nebulizers help. See, I would say again, the key is prevention. You have to make sure that you don't get the disease. And it's similar to COVID. The transmission, the symptoms, almost the same. It's very difficult to distinguish between COVID and flu, actually. And again, it comes down
Yeah.
to vaccination. I would say vaccination is the most important thing for prevention. It doesn't give
Hmm.
you 100% protection, but it gives you around, say, 60% protection. You might still end up getting infected, but you won't get complications. You won't land in the hospital. You won't need hospitalization. You won't need ICU care. You won't end up with pneumonia. So it does give you that sort of, especially for the high risk, the elderly, very young children, those with comorbidities, immunosuppression patients, and cancer patients. It's a boon for them. Apart from that, hand washing, wear a mask when you're in crowded places, public transport, gatherings, malls, markets, especially for the high risk population. And
Is
when
it
you have,
easily transmittable?
yeah, it is. H3N2 is more transmissible than the other strains. And if you have a flu-like illness, the least you can do is stay at home so that you don't transmit it. Don't go for work. Don't transmit it to everyone else. They'll go home. They'll give it to. That's how it spreads. And
Correct.
children, if they have a flu-like illness, don't then send them to school. Because see, most of the household is the children. They bring it back from
Mm.
school, and then everyone gets. And if you have vulnerable people at home, grandparents and stuff like that, then they tend to get into problems, especially if they haven't had a vaccine. And the vaccine this year does cover age 3 and 2. That's the best part. So people who have been vaccinated will be protected against this, at least against the complications. They might still end up getting infected though. So vaccination is a must. In our country, there's lack of awareness. The rates of taking this vaccine are dismal, actually. Even with healthcare workers, it's about 30%. And the high risk, it's about 1.5%. That's hardly anything. I mean, most of the countries, it's a norm, and people are aware that I have to take my flu shot. But over here, we actually have to convince people, and they're not convinced. A lot of misinformation, again, regarding vaccines. But I would advise everyone 6 months and above of age to take the vaccine every month, every year in the month of September, October, just before the winter season sets in.
So that is something I wanted to ask you, how often to take this flu shot, and something that you said it's now updated. I mean, it now covers age 3 in virus. So
Yeah,
is this vaccine updated every year?
yeah, every year.
Every strain then?
The flu vaccine is updated twice a year by WHO. So for the northern hemisphere, they come up with these strains in Feb, and for the
Mm.
southern hemisphere, Australia and all those countries, it comes up in September. But for us, the four strains that they actually tell us to take that particular year, like this year, it was H3N2, H1N1, and two influenza B strain. That
Mm.
works for the 25-26 season. So it's not twice a year for us. For us, it's a northern hemisphere is once a year. And for southern
Mm.
hemisphere, again, September they'll come out, and that works for their winter in April. So the strain which they have advised for the northern hemisphere in Feb will work till the next Feb for us because it keeps mutating. The strain, the prevalent, those strains are different each year. So they decide which ones will be prevalent this season. So these four strains should be covered. Then the manufacturers pick up those strains and make a vaccine. And that vaccine works for a year. And every year they keep updating it.
So what are the vaccines one should take? One is the flu shot, which you should take annually. I mean, are there, I mean, we know the regular ones, but these annual ones, which one would you recommend?
Well, for adults, flu shot is a must. Apart
Mm.
from that, for the elderly and those with high risk, I would advise a pneumonia shot. And the best part is, off late, we've had a couple of weeks back, they've launched a new pneumonia vaccine, which is one shot for a lifetime. Earlier, there were
Oh.
two types of vaccines. You had to take one, then 1 year later, the other one, and the other one had to be repeated every 5 years. There's nothing like that now. Just one pneumonia shot. It's called Prevnar 20. So for the high risk, it's not for everybody. For the high risk, for 65 and above, yes, they should take a pneumonia shot. And then the shingles vaccine, Shingrix, that's for 50 and above. Everybody 50 and above should take the vaccine, especially if they're immunocompromised, especially if they're diabetics, because the incidence of herpes zoster is more in immunosuppressed diabetic patients, cancer patients, those on steroids. So they should take. So these three vaccines, I would say, flu, pneumonia, Shingrix, hepatitis B, you should check. Most of us are actually vaccinated, but you'll be surprised. Majority of the population might actually not be immune to hepatitis B. And there's a vaccine. You have to take three
Mm.
shots. And there's a way of checking it. There's a blood test which tells you your titers. If it's less than 10, you need a booster, even if you've been vaccinated in the past. So that is something because hepatitis B can cause chronic liver disease, liver cancer. So I would say broadly, these are the vaccinations which are important for adults.
That is really essential. I think this is something we need to highlight. In fact, I would ask you also to write one of your columns on that because I've been reading your columns, I think, in the Indian Express. This is something we all miss, this we only react when there's an emergency, but we are very bad on preventives. So I would urge you to write that. But moving on, you spoke about COVID complications. Are we still, because people are still getting tested positive for COVID? But is the strain milder? We should not worry so much. We should, what would you recommend?
I would say it's like common flu now. It does cause complications, a very few, the way flu does, but no big deal. It's like fever, cough, cold, sore throat. Most of the people getting better. It's not like the Delta wave where everyone was getting complications, pneumonia, hospital beds were on, and
Mm.
that's over. That's done and dusted. Now it's more or less like flu, seasonal flu, common flus, and we know how to deal with it. There's no specific medicine for sure. Most of the antivirals, I don't think they work, and there's nothing which is specific for COVID. But we know how to manage it. People are smarter now. They know they have to check their saturation if they know they have COVID. They have to take the nebulizers. They have to take the routine symptomatic treatment. And the key is to be in touch with your doctors. And if you need, get tested, because if you know what you have, naturally you'll be more proactive. You'll take those measures which should be taken. So, but I wouldn't be too worried about COVID now. It's like seasonal flu.
Okay, well, that is what, one was hoping that this strain would mutate and it won't be so serious. But maybe whenever you say COVID, people do take two steps back and, get a bit worried.
Yeah,
Uh,
yeah.
is that fear of
That's understood because of what we have dealt with in the
with
last few years. Yeah.
Yeah, so a lot of people are now also blaming everything they have, whether it is a heart attack or any other, disease, on the vaccine. Has that stopped that fear? I remember 6 months ago when you and I had a conversation that was very, very prevalent.
No, I think even now people do ask me about the COVID vaccine because you keep hearing about these deaths in young people, but
Hmm.
I don't think there's any credible evidence to say that. See, ICMR did a study and they found that there was nothing to link it with those deaths. In fact, the odds were low for people who had taken two vaccines compared to one or unvaccinated. So even otherwise, there is no data. The only or I wouldn't say even major, severe side effect was myocarditis, pericarditis in young adults, adolescents, males especially. And that
Hmm.
also was in the ones who were taking the mRNA vaccines, the Moderna, Pfizer vaccine in US. And those
Right.
side effects were also transient and most of them recovered. So broadly, I wouldn't say that the vaccine is responsible for deaths. There's no evidence to see. Priya, I'll tell you, most of the people, even now, don't get medical health checks done. They don't
Hmm.
know whether they are diabetics or not. They don't know whether they have hypertension, whether they have cardiac issues, with their cholesterol things. See, most of them, even with the ones who have these issues, they are in denial. So I
Correct.
deal with it on a daily basis. I tell patients your blood pressure is very high. It's been high for quite some time. Last time when you came, it was high. Why don't we just start you on? No, doctor, I will do lifestyle measures. I will do this. I'll do that. I'll lose weight. And that never happens practically.
Hmm.
And it's not only about your lifestyle. You can't change your genes. There's a major component of genes. You have a strong family history of heart disease. You have a strong family of diabetes, hypertension. So what can you have to take medicines, but no matter how much you try to convince them, statins, there's so much of misinformation. They have a family
I
history of
agree.
heart disease, but nobody's taking it because they read something on the social media. Which medical book says you should not take it? They don't listen to doctors. They'll go by what their neighbor said, what their friend said, and what they've read on the social media platforms. It doesn't make sense. So people have to be really aware. They should go by authentic advice given by doctors or those websites which are medical websites, which have some credibility, WHO, CDC, Indian health websites. So you can't go by by hearsay or what is there on the social media platforms. So I won't give too much importance to this COVID vaccine thing or the fact that people die because of the. See, 140
Hmm.
crore people took the vaccine. Come on, there's hardly been any issue. And the deaths which are happening, how do you know why are they happening? They could be having an underlying heart disease, for all you know.
Correct. No, in fact, I like your point about, don't go to the social media because that is the chat GPT is really the new doctor. But I'm going to come back and take a break and come back and talk to you about another topic that is doing the rounds, which is these weight loss drugs. What is your stand on them? Because we have doctors on one side, we have nutritionists on the other side, and, fitness experts who argue against it. We are told, the do's and don'ts. So that's something I have you on the show. I really want to ask you about that, but after a very quick break. Hello and welcome back to a cover story conversation. I have with me Dr. ROMMEL TICKOO. He's the Director Internal Medicine at Max Healthcare. Dr. TICKOO, really, this is a topic I really want to raise with you is these weight loss drugs. We've seen people originally meant for diabetes, but now I think everybody is taking it for lifestyle management. There've been success stories, but now we are getting the backlash. We are saying don't take it, you'll have pancreatic failure, etc., etc. So what are the do's and don'ts? What is your stand on them?
Priya, these drugs are not meant for everyone. So there's a specific indication, and for the ones there is an indication, works like anything. See, I'll tell you the indications. For
Hmm.
diabetes, where you have failed lifestyle interventions, medicines also have been tried, or you can start these drugs. There's an indication. Then obesity, where your BMI is more than 30. Then, and again, when you have failed lifestyle measures, why I would say at least 6 months, you've done diet, you've done exercise, not losing weight, and there are chances that you'll end up with complications now, diabetes, hypertension, stuff like that. That's the indication. And then 27 and above BMI, but with at least one of the weight related issues, which is diabetes, hypertension, cholesterol, fatty liver disease, obstructive sleep apnea. So, in them, again, as I said earlier, when they have failed a lifestyle intervention, that is when you have to use them. And when you use them in such a population, it works wonders. It not only reduces the sugars or the weight, it helps them in every way possible. It reduces the fatty liver, it reduces the blood pressure, it takes care of the sleep apnea. And there's so much of evidence to say that it reduces the risk of cardiovascular events in these patients. So you see,
Oh.
there is a huge benefit, and we have a lot of
Hmm.
evidence to say that in this particular population. Now, if you use it for vanity and you want to
Ah.
lose 5 kgs, I have a lot of young girls, women coming up to me in OPD and saying, please prescribe us this drug because there's a wedding in the family and I want to look good. And
Correct.
there's an event coming up and I need to lose those five. Just give it for 2, 3 months and then I'll be done with it. That's not how you're supposed to take it. There has to be an indication. And because availability, accessibility is easy in India, it can be abused.
Hmm.
So it's not meant for everybody. So I have to counsel them. I have to tell them how it can harm you. It's not a drug for everyone. It can help those people who need it. But if you take it
Hmm.
just to look good, it can harm you. And there are side effects. So the side effects are mild and they can be taken care of. GI side effects, nausea, vomiting, constipation, diarrhea. And most of the patients do know how to manage it. And initially there is an issue, but they get used to it over a period of time. Then comes the severe side effects, which
Ah.
is written about cholecystitis, pancreatitis, patients who have underlying proliferative diabetic retinopathy. It can worsen because sudden decrease in the sugars can trigger that issue. And the paralytic ileus, intestinal obstruction, and then those who have history of medullary carcinoma of thyroid in the family or personal history, or men too,
Hmm.
those kind of cancer is contracting. So who's going to tell you all this? The
Yeah.
doctor will tell you. He will see. He'll get your eyes checked. He'll see whether you have history of pancreatitis, whether you have history of thyroid cancer in the family. He will tell. So if you take it without prescription, without medical supervision, then you will end up with trouble. And then you can't blame everyone and say, see, this drug is doing this drug is doing that. Again, while you are on it, the weight has to be monitored, the sugar has to be monitored, the kidney functions have to be monitored, the GI side effects have to, maybe you'll have to stop it at some point.
Hmm.
If you keep taking it in spite of the side effects, naturally you'll end up with problems. So let the doctors decide. Now, coming to your question about nutritionists,
Hmm.
they're, they're right to the extent that it cannot be used for everybody. Don't go to a doctor and ask him to prescribe it because you want to lose weight. So the first thing that you need to do is lifestyle intervention. Just work on your diet, stop eating junk, increase the fiber protein, cut the carbs, 1 hour of workout, a brisk walk, whatever. Do it religiously. Don't eat after 6, 7 in the evening. Have lots of water, fiber. And people do lose if you're disciplined. But what if you don't lose weight in spite of doing all this and you have a comorbidity and you have diabetes, or you don't have diabetes, you're obese and you have sleep apnea, you're drowsy during the day, you're not able to work, your energy
Hmm.
levels have gone down, then what do you have? A grade 2, grade 3 fatty liver. You can't tell them, don't take this drug. No, that wouldn't be the right thing to do. And again, the nutritionists are not qualified to talk about the drug. I mean, you need to know what the drug is all about for you to tell whether you can use it or not use it. I'm talking about it because I use it, I've read about it, I have been told the do's, don'ts. That's why I'm using it. I'm authorized to use it. So somebody who's not qualified, somebody who's not authorized to use it, I would advise them to refrain from
Great.
passing comments like that. Let the doctors decide. You're right to the extent that it shouldn't be used for everybody. It's not the first thing that you should go to. But again, let the doctors decide who needs it and who doesn't need it.
No, because as a quick fix, a lot of people I know are taking it just for that event, 4 kgs lose to karna hai, then I will maintain it. So when they do that, what happens in terms of even, when they stop taking it, you gain back all the weight, like when you go off a diet, does it
Yeah,
work the
yeah,
same
it
way?
does. Most of the cases, it does. Especially if it's a stopgap arrangement. You want to look for
Huh.
a particular good for a particular event. Naturally, you'll go back to your old lifestyle, your habits of eating food, junk food, whatever, alcohol. So you
Hmm.
and even otherwise, most of the patients, if they don't maintain a lifestyle, a healthy lifestyle, they tend once you stop the drug, there are chances that you will put on weight. So during the 6 months, 1 year, while you're on the medicines for the ones which is indicated and prescribed, they have to change their lifestyle also. You have to get into the habit of eating healthy, exercising. It's not that you have to do it for that time frame and once you're off the medicine, you lost weight and now go back to your old habits. No, it's not going to work. You'll put on weight again.
Hmm.
I have seen patients
Okay.
who've done a bariatric surgery and
Yeah, that was.
they have gained weight again. And they're on these drugs and again they're not losing weight because the lifestyle is so bad. What do you do? There's no option for them.
So
So
bariatric
lifestyle.
surgery versus this, which one is better? Monjaro, Wegovy versus
Well,
bariatric
I
surgery
would I would say this should be your first option. This is a medical option. Surgical
on third.
options are the last option. Again, when you have side effects or you have contraindication, you cannot take these drugs, then you are left with bariatric surgery. Again, the doctor should decide. See,
Hmm.
it's not one size fits all. Some people will need the medicine, some will need the surgery, and it has to be well thought of decision after you discuss with the patient, his family, explain to them the side effects, or both, whether it's the surgery or whether it's these drugs. So then you take a decision. You'll only take a well
But
thought out decision when you're told about the side effects. You're told about what can happen, and you're also told about what can happen if you don't take care of your weight. That's a bigger problem than the drug giving you a problem. You have to see the
that's
risk
true.
benefit ratio.
So how do these drugs work? They work on your, they don't make you feel hungry. I mean, in layman's terms, they work on
Yeah,
your appetite.
the mechanism is different for the drugs, and but what actually they do is for a layman is they delay the gastric emptying. The food stays longer in your stomach, GI tract, so you don't feel hungry. That's why the
Hmm.
side effects. That's why the constipation. That's why the burping or whatever gastric issues, and that's why you don't feel you develop aversion to food, and that's how you lose weight. And the side effects are taken care of. You get used to them, and once
Every
you
time
lose.
you take an
Hmm.
injection, that day, there's one day that, is totally gone. People are saying that's one day you feel nauseous, sick. So once a week, you're writing off one day of your life.
Hmm. No, but that happens initially. I think over a period of time you get used. It also depends on the dose. You start with a lower dose for 4 weeks, then you go to a higher
Hmm.
dose in 4 weeks, and at some point you stop, or very rarely you go to the maximum dose of these drugs. See, the
Huh.
maximum problems happen at the maximum doses. So if it's a moderate dose, usually patients do manage and they do lose a lot of weight. But you don't go all the way with the maximum dose in most of the patients. So it's
So
again a dose related. Hmm.
is it like statins? I mean, once you take it, you have to be on it if you need it like for a medical reason or whatever. Because the minute you go off it, you are going to gain weight.
No, I wouldn't say that you have to be on it forever. But see,
Huh?
if you had a bad lifestyle and you were not taking care of your diet, exercise, and suddenly you taken these drugs, you lost weight, and you realize that I should eat healthy, I should exercise, and I should stop drinking, smoking, and things like that. And then you get into that habit. For if you do that for a year, naturally it comes to you, and then
Huh.
you don't need the drug. But that will happen only depending on your willpower, your determination, how disciplined you are. But if you go back to your, as I said, old habits after stopping, then probably you'll need it forever. But again, you know they have side effects and things like that. So, but whoever takes it has to take it for at least 6 months to a year. Otherwise, it doesn't make any sense. So we'll have to see. Even with side effects, it's too early to comment. Now we'll
Hmm.
have to see. It's just been started. We'll have to do Indian studies and things like that. And there have been lawsuits in US against these pharma companies. Those are
Right.
manufacturing these. But again, nothing is proven. It's ongoing. And you have to see whether you actually have evidence to say that this is what it is. And most of these are actually claims that we didn't know about it. There was not enough information about it.
Hmm.
Again, it's not that
And
most of the guidelines say you should give it to the specific population for which it's recommended. American Diabetes Association, American Association of Clinical Endocrinology, they all recommend it for this particular group: obesity, diabetes, especially uncontrolled diabetes with all the other risk factors, since it takes care of other problems also: sleep apnea, fatty liver disease, hypertension, reduces your cardiac risk. So why would you not take it and take it? How can you live with obesity? Lifestyle hasn't worked, lifestyle changes haven't worked. You are a smoker, you have a strong family history, you have uncontrolled blood pressure. Naturally, you have to do something about it, and it works for them.
okay, thank you for this, because this is something I think the health tips are essential, especially with the festive season coming up. I think this conversation has been very useful, and I hope to keep doing more conversations with you. But on that note, thank you so much for talking to us.
Thank you. Thank you so much.